I have a 28-year-old female presenting with increased exacerbation of asthma symptoms over the past 2 days. She's had a recent trigger of her allergic asthmatic response after being exposed to an allergen at a family member's house who's got a cat. About 2 days ago, she was there and has noticed an increase in her asthma symptoms since. She's mostly complaining of the increased shortness of breath. That happens about every 4 hours. She's also got increased wheezing, and the shortness of breath wakes her up about twice a night over the past few nights. She denies use of any asthma journal to track the disease exacerbations or progress. She doesn't use a peak flow meter or a home nebulizer, nor does she use intensive spirometry. She's had asthma since she was about 2.5. She's been hospitalized about 5 times over the course of the disease. She's never been intubated. Last time was about 12 years ago that she was hospitalized with this. On physical exam, she's got normal chest expansion, symmetrical respirations, chest is resonant to percussion. She does have bilateral expiratory wheezes in the posterior lower lobes, but no crackles noted. Spirometry today was normal, 3.91 for volume, and her ratio is about 80%. SpO2 is 97%. She feels that she's breathing normal at this time, but doesn't feel the albuterol inhaler is controlling her symptoms as well as it used to. My assessment is that her asthma is not really well controlled on just the short acting albuterol. And there's some need for education on both symptom management, avoidance of triggers, and just disease management. I would initiate an asthma symptom journal to track the progress of how she's doing. She can just write, we can send her with that, and she can just quick update it anytime she's having symptoms, how well the medications are working, and what she's using to treat those. I'll go over some more education with her on inhaler technique, and I would like to change the inhaler to inhaled glucocorticoid like Flovent, 110 micrograms, probably 2 puffs of that BID, and keep the albuterol going for short acting as needed. Also, some more education for her, I think, would help get her back to square one, and avoidance again of irritants, and making sure that this isn't limiting her ability to exercise. We want her to be able to move. She's again only 28 years old. So just some education today, and maybe pick up that change in medication, and see her back in about 1 to 2 weeks.